Okay, I think we will get started. Hello, everyone. Welcome. Good morning, good afternoon, good evening. Very warm welcome to all of you for joining us virtually for the opening plenary of the 2024 Global Health Landscape Symposium. I'm Elisha Dungiorgio. I'm the president and CEO of Global Health Council, and it's really my privilege to open this year's event. We've brought together an incredible global community of leaders, experts, and practitioners, all of us with a shared vision for a healthier and more equitable world. So everyone's turning in virtually, whether it's from your home office, somewhere in between. If you're in a train, plane, we're just really glad that you're here with us for these important conversations. And this year's theme, Leadership and Policy in Global Health, Navigating New Frontiers, I think feels particularly urgent in light of the rapid political, social, and economic changes that are reshaping our world, which we've really seen over the past past couple of weeks, even more so perhaps. But all of these political shifts, these changing policies, and certainly ongoing global crisis really remind us that global health is deeply interconnected with broader forces shaping societies. And I think, throughout this symposium, we're hoping that we hear the innovative ideas, the informed policies, and the bold solutions that we all know are really essential to addressing the opportunities and the challenges ahead. And so to kick us off for the symposium and really help us frame these critical conversations we're going to have over the next few days, our opening plenary panel, Global Health Frontiers, Technology, Equity, Climate Resilience, and Financing Solutions, brings together a tremendous panel of experts who will spark inspiration and hopefully provide actionable insights for all of us. Their perspectives will really help us set the stage for the virtual sessions ahead, where we'll dive deeper into many of these themes. So we're gathering virtually, but I want to just encourage everyone to make the most of the symposium. It's more than a series of discussions. It's really an opportunity to connect, to learn, to act. I hope that you all will be, able to engage actively, ask questions, bring your unique voice to the conversation so we can really work together collectively to reimagine what's possible in global health. With those opening remarks, I'll just say again, thank you all so much for being here. And I know everyone that's joining does incredible work every day. So we're thrilled to have not just the panelists, but also the participants in the audience who have tremendous knowledge to share as well. And with that, I would like to welcome our visionary panelists for the opening session. I'm very pleased to be joined by David McAfee, who is the CEO of Viamo, Christophe Ben, Director for Global Health Diplomacy at the Diop Lang Institute, Yassine Djibo, Founder and CEO of Speak Up Africa, and Vanessa Carey, the CEO of Seed Global Health and the WHO Special Envoy on Climate and Health. Thank you all so much for joining us this morning. And just for quick, housekeeping notes, we're going to begin with some opening remarks from each panelist, followed by a few discussion questions from me as the moderator, and then we'll open to questions from our participants. So with that, I would like to invite David to start us off with some thoughts about how do we harness technology for global health in this moment of navigating new frontiers. David, over to you and welcome.
Great. Thank you very much, Elisha. I'm honored to participate in this distinguished panel today. I'm going to speak to the technology and equity parts of our ambitious plenary session title. So as you know, in technology circles, the hot topic of the moment is generative artificial intelligence, or Gen AI. And our partners working in development, but also in the humanitarian sector, they're exploring how to incorporate generative AI into their work to increase productivity and efficiencies. Now, today, I'm going to give you just one small example from our recent work in Africa of how Gen AI can change lives and even save lives. And my aim is to give you an idea of how transformative generative AI can be for people, even for those of us who haven't gotten online yet. So to tell that story, I need to tell you just a little bit about my company, Viamo. So we're a Canadian social enterprise. We have people and offices in 25 emerging markets, mostly in Africa, but with a growing footprint in Asia. And we're a platform company. And we think of ourselves kind of like Google, but for people who have a device that's less capable than a smartphone. So I carry around my old flip phone just to remind people of what the days used to look like. Because the problem we're trying to solve is that there are about 3 billion people on the planet who don't use search engines, right? They don't have the right phone. They don't have access to the internet, but they do have a simple mobile phone in their pockets. And to help solve this problem, we launched the Viamo platform. And last year we had about 24 million people use our platform the way that we all use Google. They searched for information and we connected them to our partners to access goods and services. And we did that all through an automated mobile phone call. So we use the same technology that you use when you call an airline. You call their 1-800 number, you hear push 1 for ticketing, push 2 for reservations. But when our users call their toll-free number, they hear welcome to the Viamo platform, push 1 for public health, push 2 for agriculture, push 3 for education. And partners like Johnson & Johnson and WHO and UNICEF and BBC, they've just all signed up to be on our platform. So the goal in version 1.0 of our platform was to provide our users at the base of the economic pyramid with on-demand access to information in that interactive way, free of charge, and we've succeeded at this. So last year, 24 million people in Africa and Asia, they called us about 400 million times. They conducted about 800 million knowledge searches. They spent about 2.1 billion minutes on our platform, and that's roughly the equivalent of about 4,000 years. And notably, about 32% of our users called us using an internet-enabled device. So in short, we've become the #1 single point of entry to the digital world for the next billion users. Okay, so what's next? Because everything I just explained happened before the generative AI revolution. When OpenAI launched ChatGPT, it gave us a disruptive opportunity to transform our users' experience and make our platform even 10 times more valuable. So the next step in our platform's evolution was to add an Ask Viamo Anything feature, again, powered by generative AI. So about a year ago, we piloted this Ask Viamo Anything feature on our Viamo platforms in Zambia and Nigeria. So instead of pressing buttons on your phone, you could ask any question, and it was a huge success. So we rolled this out slowly and carefully, but when we gave access to any group, traffic basically tripled. So to date, more than 25,000 people have asked around 350,000 questions across a huge range of topic from the comfort of their own phone. But public health related questions were by far in the majority. So when people could ask any question, what did they ask? So to try to get a handle on that, we put all of the questions through a word cloud generator. And here are the results. As you can see, when our users had the chance to ask Viamo Anything, they asked thousands and thousands of questions about sexual and reproductive health. So some of the most intimate and private questions that humans ask. Women use the Ask Viamo Anything more frequently than men. They call back more often. They stay on the line longer. They ask follow-up questions more frequently. So in that sense, we feel like we are making a small but meaningful contribution to narrowing the gender digital divide. Now, we're working with a coalition of partners to bring the Ask Viamo Anything feature to all of our platforms worldwide. If you're interested, please join us. I'll share some links in the chat of first-time users in Zambia, and then I'll also share our demo line so you too can ask Viamo anything yourself. So let me stop there. Elisha, back to you.
Thanks so much, David. And just to say, one of the reasons we wanted to start with the technology conversation is because I think people find that there's some hope and optimism in how generative AI and other technologies can really help to do what you just said of bridging the gender divide in global health and counteracting a lot of the misinformation that we're hearing right now. So look forward to talking a little bit more about the broader spectrum as we move into the Q&A, but thank you for an example of Viamo. I'm going to turn next to Christoph Ben to talk about a topic that maybe doesn't feel as optimistic to many of us in this field, health financing. And Christoph, I'm going to just turn it right over to you. I know there's a lot to say here, particularly given the political moves that have happened in just the past couple of weeks, not just in the US, but in several European and Asian countries as well. So please, the floor is yours.
Thanks so much, Alicia. It's really a great privilege to join you this morning, and I will be as optimistic and realistic as I can in this context. As you already alluded to, everybody in the community is aware it's a particularly challenging environment. We don't know yet exactly what the outcome of the US election will mean, but it will certainly not become easier for many of the main multilateral health organizations that drive the global health agenda. But that's not all. There are significant budget cuts in major European countries like the UK, France, Germany, and others. So it is a very, very challenging environment for many of the organizations, also those that are going through replenishments right now. But there are also, I think, positive moments. And one of them is actually happening right now, today. In Rio de Janeiro, the G20 Leader Summit is commencing today. And for the first time ever, a global health organization has received the chance to have a pledging moment as part of the G20 Leader Summit. So today, WHO's investment round will have its culminating moment, asking for additional pledges from G20 leaders and invited guests. And this is not the first one. It's a series of moments. WHO, for the first time ever, has engaged in a year-long, kind of replenishment campaign. And we will know the outcome by the end of this day, basically. And while it will be clearly difficult for them to compensate for a potential loss of a major donor like the US, the good news that will come out of the G20 meeting is that an unprecedented number of member states will have pledged. I understand right now it stands like 70 member states will pledge. 40 of them have never pledged before beyond their assessed contribution. So really broadening the donor base, I think, is the very, very important aspect these days. You cannot rely on a limited number of countries that have, traditionally financed everything. So very good move in line with the principles of global public investment. All countries contribute according to their ability, and WHO clearly being a global public good. So that's my first statement, but you've asked me to comment on innovative finance, and I will do so. But I think it is important to say I have been a lifelong practitioner of innovative finance and initiated some innovative finance mechanisms myself, but always with the realistic understanding that it's complementary, never with the assumption that private sector and innovative finance could replace, major public donors. So that's what we are exploring now here, to say, look, this is important, this can complement, but it has to be realistic in what it can do and what it cannot do. I'm trying to get my slide up if possible. I'm not sharing that. Yeah, great. Thanks a lot. So you should see a slide, and because I cannot explain in 3 minutes the whole innovative financing, landscape, there are so many different elements, so many mechanisms, and so on. What I thought I'd do is I present you with a taxonomy that I published with a colleague just a few months ago. That might be helpful to kind of navigate this complex, landscape of innovative finance. There are voluntary contributions, and they are important. Like the Project RED that the Global Fund has initiated many years ago. And they have no cost recovery in mind. It's principally straight grants, through consumer marketing going to certain health programs. Then you have conditional funding, cash on delivery, performance-based funding, very important. I'll come to debt swaps in a minute. And then increasingly you come to mechanisms that seek, cost recovery. And I would also say there are some that actually work through loans and blended finance and so on. But in this current environment, where so many low and middle income countries are already over indebted, I'm quite careful with any mechanisms that add actually to the debt burden. And I'm looking more for mechanisms that reduce the debt burden. So that's in a nutshell. We can come to that. If there are questions, we can share that. But just to give you a taxonomy to navigate a little bit this complex world of innovative finance. So out of all those, I just want to focus on one, and that is debt swap for health, something that has been introduced 17 years ago, but Brazil, through the G20 presidency, brought that up on the agenda again. And there's a reason for that, because this is the one mechanism that can address one of the key issues of our time, that you see increasing debt burden and therefore debt repayments in many low and middle income countries. And these debt repayments often now exceed the domestic investments in health and education. That's a tragic trend if you repay more debt than what you're investing domestically. And that's what a debt swap is trying to kind of reverse. Getting a creditor to cancel, part of the debt with the obligation that this canceled debt is then invested domestically into health. So that offers some opportunities, much discussed during the G20 and probably in the year to come. So that's one of those mechanisms that I think could be quite promising for the future. Because indeed, what we need is mechanisms from public, from private, from innovative, that can do exactly, I think, also what David was talking about. We need much more investments in climate resilient health systems, and hence through digital technology. There's a real hope in there. There are real opportunities in there, but still they need to finance with support from the international community. That is one of the great opportunities ahead of us, and we are following the COP29 in Baku. We just had the biodiversity COP here in Colombia. I'm speaking from Bogota today. So we have all these big opportunities and challenges, and we can only address it through combination of increasing public finance, innovative finance, private finance. Then I think we can help countries develop these climate resilience health systems that we so urgently need. Thank you.
Thank you so much, Christoph, and thank you for starting with the positive news on WHO. That's great to hear. I know many of us are watching all of the financing conversations happening and are feeling a little worried about the sector generally, even with the advent of innovative financing, which, as you described, is not quite where we need it to be, although promising. So it's great to hear the WHO news and look forward to seeing the pledges later today. Next, I'm going to turn to Yassine Jibo from Speak Up Africa. I think so far we've talked quite a bit about technology and about financing systems and governments and debt swaps. And of course, all of this is to be in the interest of people and of hopefully addressing the health inequities that we see across domestic national health systems as well as the global health system. So Yassine, I'll turn it to you to speak to that and to the importance of thinking about and engaging civil society and communities.
Thank you very much, Elisha. Good morning, good afternoon, everyone. I'm honored to be on this panel this morning. I think I want to start a little bit just by reminding us, all of the disparities that exist. And when we know that a child that is born in a low-income neighborhood can expect to live 20 years less than one that is born just a few miles away in an affluent area. We also know that a woman born in a rural community is 3 times more likely to die in childbirth than her urban counterpart. And as healthcare becomes increasingly digitalized, we risk creating new divides, as was just mentioned, in terms of where those without access to digital tools face even greater barriers in order to access care. And really, when I talk about this, I really want to say these are not just numbers. It's really the human cost of systematic inequities that are embedded within our health systems. And the challenges we have before us are structural, they're deeply rooted, and our health landscape, unfortunately, is very much characterized by fragmented initiatives, insufficient political will, and inadequate governance of health data. And what we see in traditional governance models often is that they do exclude marginalized voices, particularly women. And in the digital health, we see that even more so when we see that 30% of women in sub-Saharan Africa, for example, receive STEM training and participate in tech sector. So our financing mechanisms as well continue to create barriers rather than bridges to care. But, I say this just to set the context, but I do think there is hope as well. And this lies in transformation at 3 critical levels. The first one is around governance. We really need to move beyond token representation to genuine power sharing with communities. And what does this mean? It really means that ensuring these vulnerable groups, especially women, have access to health services that are accessible, affordable, and adapted to their needs. And we really need to restructure our decision-making bodies to ensure that they include those that live with these experiences of health inequities, and really also create the accountability mechanisms that respond to our community priorities, not just using institutional metrics. And we believe that digital platforms can also amplify these voices, but only if we ensure that communities are a part of design through implementation. The second element has just been discussed is really around financing. In addition to putting in place the financing mechanisms that prioritize equity and resource allocation, we also need to ensure that we have autonomous and catalytic funding that is available to those communities that need them most, and that they are able to access those resources. Often the resources are sometimes available, but communities and community-based organizations are not able to access them. And the third piece I wanted to quickly discuss was around policy. We need to ensure that when we're designing the policies, we ensure that we are including communities within the policies, and that the specificities, especially when it comes to what they need, is taken into account, and that we're creating the proper incentives to develop solutions that serve these marginalized communities. And so the digital transformation really offers a unique opportunity to be able to achieve universal health coverage, but we need to ensure that it's anchored in human-centered design principles. We need to ensure that user engagement is accounted for, and that communities are integrated within the whole process. So this is what I wanted to share. And the topic is so large, but really just the key message is ensure that we're rethinking power structures in health systems, that we're bold in our financing reforms, and that we're centering community voices at all levels of the health systems. Thank you.
Thank you so much, Yassine. I really appreciate those remarks. And I know we'll dive into that discussion a little bit more, maybe tap into some of your ideas on pragmatic steps to do just the things that you mentioned. Lastly, for opening remarks, I'm going to ask Dr. Vanessa Carey to step to the front virtually and share some thoughts with us on the state of climate change and global health. Over to you, Vanessa.
Thank you very much for having me, and good morning, good afternoon to all. I think it's very poignant to be having this conversation, particularly in the context of the recent COP16, the ongoing COP29, and just the overall flow of where we are in the world today. I want to very much actually just start by highlighting what Yassine just said, which is that we are fundamentally talking about power structures that are withholding our entire ability to create the progress we need. And it's either to have the true financing conversations we need around investing in global public goods and what keeps us from investing in global public goods. But it's really, I think, been a kind of protectionist mentality for a long time. Whether you see how we came out of COVID, right, and looked at our vaccine distributions, we're doing a little bit the same with climate change, rather than recognizing this is a borderless problem that transcends, frankly, all of our priorities. And we have to get very, very thoughtful about how we collectively create a common shared value for this planet and its people and solve. And that is fundamental to what we're doing in climate change. And if you just look at what's happened in recent events, or what's happening today, right? There's a massive drought in Southern Africa. We have extreme heat, which is becoming a norm every summer, killed over 60,000 people in Europe 2 summers ago, over 47,000 last year, cost the United States $100 billion in productivity today, which is set to double. And that's the numbers we do know. We're not even calculating that around the globe. Horrible flooding in Valencia just a few weeks ago. And these are just a few of the incidences that I think have been reported, and we're hearing them with much more frequency all the time in all the places. And I think the reality is that public health emergencies, like outbreaks, are not one-time events. They are our norms now. They reflect our changing environments, social and political issues, injustices, and inequities that are everywhere. Climate change is fundamentally a health crisis. And health is the lived experience of climate change. It is the way that all the climate issues ultimately come down. Because if you don't have shelter, you are not safe. If you don't have food, you suffer from malnutrition. If you're at risk of vector-borne diseases, you get sick. You can't take care of your family. You can't go to school. You don't go to work. And then whole communities and whole countries suffer from their GDPs. Already, the WHO reports that 1 in 4 deaths are from preventable environmental causes. And we're seeing climate change drive all diseases. I mean, you all know this, but it's mental health, non-communicable disease, vector-borne diseases, maternal health, emergencies. And so we know that nobody is safe in this current environment. And the problem is that we think of health still in a silo. So health is an isolated topic. We think of health as something that is specific, that we must worry about, and oftentimes, candidly, is set to the side. But health actually is a fundamental underpinning of every sector that we are thinking about in this world today. Consider the economic implications. Illnesses have far-reaching consequences. So it's a human sort of productivity issue, that if you're too sick to go to work, you lose your monthly income or your hourly income, or it might be a choice between buying medicine or something else that you need for your family. In the US, where I sit, or I'm based, the extreme heat is costing the US $100 billion a year, and that's expected to double in the next decade. About half the US workforce actually is suffering from the health impacts of climate change, and only about 17% of companies worry about that, even though there's a direct line to their productivity. The extreme heat that's experienced in India during 2021 not only caused immediate suffering, but caused an economic loss of income loss of almost 6% in the country overall. And if you look at what's happening in India today or in Pakistan with choking smog, that has very real implications on people's ability to go to work. More people die a year from air pollution than we lost in the entire duration of the COVID pandemic. And further, we lose 8 trillion in GDP a year from air pollution. But climate change is also a security issue, a human security issue. It's an economic issue in that sense of security, but there's an estimated 1.2 billion climate migrants that are expected by 2050. So what we're worried about now on our borders is going to be much more massive over time as there's pressure of resources, unlivable living conditions, rising seas, drought, other extreme weather, and flooding. And today already, 3.6 billion people live in vulnerable areas, and an average of 21.5 million are displaced annually since 2008. So we're looking at masses of people and shifts of movement that is going to put immense pressure on our world and how we live. On a gender issue, many countries now are reporting that because of climate changes, it's resulting in longer dry seasons. And women and girls who are already the most vulnerable to the impacts of climate change have to walk further now, just to give one concrete example, to obtain water, which has been putting them at risk, much higher risk of sexual and gender-based violence. So the truth, when we talk about what our response is, a health-centered approach to climate change is actually a multi-sector approach to climate change, and strategies for integrating climate resilience into our global health systems is a critical response. I was very pleased to hear the World Bank talk today in Baku about the fact that as we approach our health response to climate change, it's not a disease-focused response. It's actually a whole health system response. It's a UHC response. And that's exactly right. Because climate change is impacting everything, we have to have a response that is holistic, flexible, resilient to all the changes we're seeing. So just to make a couple pointed ideas, health systems are fundamentally the main line of defense for populations faced with emerging health threats. And so to protect health and avoid widening health inequities, we have to build climate resilient health systems. Second, health workforce is the leading edge of those health system resilience that we have. There's already a global shortage of 10 million health workers. We are at a huge disadvantage when we see what those shortages look like, because health workers are on the front line of responding to emergencies, to surging when there's flooding and cholera and malaria and Ebola, to addressing the rising burdens of non-communicable disease, to supporting women to deliver in childbirth, or to meeting the next COVID pandemic. We know we need more data, so we have to be able to support countries to assess their climate and health gap vulnerabilities, and that VAAs are critically important. The WHO is a whole tool that is critical to using this, or to being able to understand what those are going to be needed for us to make the most rapid and appropriate responses that we know work. And then finally, I guess the penultimate point is that we must recognize that investing in health systems is a solution to multiple challenges. The climate crisis and health crisis is not new. This is not a new idea. It's just an accelerant of existing global health problems. And climate change is an accelerant of all crises that we see in the world today. So when we invest in strong, resilient health systems, it is our climate change resilience, but it's also our pandemic preparedness. It's our pathway to achieving universal health coverage, and it's key to addressing the existing burdens of disease that we have not yet stopped. But the final point is, for us to move forward in this world, without question, there is no path forward without a just and rapid transition from fossil fuels, which is driving the harm that we see today to our planet, to its people. And when you think about financing, for example, and our pathway to solution, we are investing well over $7 trillion in fossil fuel subsidies. We're losing $8 trillion in death from air pollution. The math doesn't add up. So if we can, as we're looking at all the solutions for mobilizing more money, it would be a very efficient step to start with a just and rapid transition from fossil fuels and the fossil fuel subsidies that are killing us today. So with that, thank you very much. And I really look forward to the conversation, and I'm grateful to see so many people that are keen to think about these solutions.
Thank you, Vanessa. That was great. Sobering, but great. I'm going to actually, since you're here already in the main screen, I'm going to maybe start Q&A with you. And at the end, you laid out some very big goals around investments, financing, UHC. Agreed, the climate and health crises are one and the same in many ways. Can we dig, though, into the practicalities of how we make that happen? I mean, the world is set up so that climate is dealt with over here, health is dealt with over here, health workers are dealt with even below health. And, I'll turn to Christoph in a minute on the financing piece as well, but it's a very segmented global health architecture and global climate architecture. So I'm just curious, from your time as the WHO envoy, which is the first time I think we've seen that role, which was a huge step forward and helped move a lot of this conversation ahead at last year's COP. How do we practically do this? Like, what's needed to really integrate these two giant architectural systems for policy and governance change and financing change?
So the good news is I think that's already starting in many ways. It's true that the fields have been incredibly, I think all the sectors have been very siloed, and health in and of itself has been very siloed. I think the health community is now very much on board that the climate is affecting our challenges, right? I mean, whether it is loss of infrastructure through flooding, or, you know, if you typhoons, drought, you know, energy insecurity that is happening for health facilities in the setting of increased demands. I think that the health community is on board now that climate change is making their work harder. I think that the climate community is increasingly starting to crumble its walls towards where the importance of health is. And it's very exciting that today in Baku, they announced the Continuity Coalition, which is from COP 26, 27, 28, 29, and 30 together have actually formed this coalition that has permanently embedded health as a permanent structure of COP now. So health is formally ingrained into COP, and there's an increasing understanding, you know, over 90% of the nationally determined contributions, which are countries' plans for meeting the Paris Agreement, and building out pathways of adaptation, mitigation, and resilience for climate change, include health. Now, the specificity of those NDCs, it gets a little more scarce, and I think that there's not a huge amount of specificity as to what those plans can look like. And with Brazil coming up next year, where the NDCs are due, I think because of the primacy health is now played, there's a much larger commitment to seeing health in those NDCs in a very structured way. And the WHO has been really ramping up the efforts to support what that can look like. So there is progress on some levels, but I would say that the challenge remains to actually even beyond the climate community, actually is to start to integrate the importance of health across sectors in general. So again, the framing needs to be that climate change is accelerating our existing health crises and kind of all crises that we see in the world today. And that is certainly increasing up. But the fundamental argument that actually has to happen is that people need to understand that health is an economic and security issue. They need to understand that it's that it is fundamental to, it links to agriculture, it links to energy, it links to all of these pieces. And I think that if we can take the step back and do a better job of really quantifying the economic impacts of health, the World Bank is releasing a report today on the cost of inaction that got released at 4 p.m. Baku time. So it's live now. That really is actually, and they're very clear that they're only outlining some diseases that create the costing. But if you can extrapolate that to all the ways that climate change is impacting health, the cost is well into the trillions and is absolutely debilitating. And I think as that is understood by high-level policymakers, it actually depoliticizes it makes health less of a kind of, this is important for the US right now and incoming leadership. Health doesn't become a social issue or kind of a trigger point. It becomes a fundamental building block of strong, stable, economically competitive societies. And so I think if we can start to shift our language and our understanding a little bit, we might be able to political proof investments in health, do a better job of linking the health and the climate conversation, but I think also making sure that health is understood as a fundamental underpinning kind of what is needed as the building block of stable and prosperous societies. And so the argument is fundamentally that, again, climate and health is not an individual topic. It is just climate's accelerant of health issues, which has wide-reaching ramifications. And I think we're starting to see that shift come out of the global south and other countries that are talking about this. And my final point would be, health is getting integrated into the G20 process now. South Africa will be taking over the G20. Climate and health will be, and health financing itself will be a major underpinning. And when you look at the World Bank's priorities under Ajay Banga, there's two: energy and UHC, getting 1.5 billion expanded on care. So I think we're seeing this shift, and now it's incumbent on all of us as a community to make sure that we're thinking very strategically about how we move health out of its existing silos, and look for opportunities. And we've submitted with the WHO, for example, to put health security in Munich, not health security in terms of vaccine, health security meaning ensure that people have access to healthcare everywhere, regardless of where they are born, because that is a fundamental requirement for us, for justice, but also for this world to be able to move forward.
Thank you, Vanessa. That's great. And I'm going to pick up on some of the conversations that you mentioned happening on health financing, and turn it over to Christoph to maybe talk a little bit more about that. I mean, Vanessa, you referred to it as depoliticization. Is it, in some ways it is depoliticization. Other ways it's really fostering political will for health as a fundamental economic security. And we have a lot of, there's been a lot in the G20 around health financing, and there's a joint health financing task force. And Christoph, you mentioned WHO pledging. They also held a pledging round for the pandemic fund. I think going into some of the other multilateral replenishments, whether it's in climate or in health, what are we looking at coming up? How do we turn all of these big goals into something practical?
Indeed, I think, as Vanessa pointed out quite rightly, we are coming from a period when health and climate were completely siloed. But the Continuity Coalition that has been launched now in Baku indeed is a step in the right direction. And at the last COP28, the two biggest funds in climate and health, the Green Climate Fund and the Global Fund, announced a new partnership. And that is now leading into really concrete action on the ground, because that's, I think, what we need. Not just, declarations, and we care about the pledges made to these organizations, but we want countries to be able to access this funding to then design the right, climate resilient health systems that we've been talking about. And that is indeed happening. This week is not only the G20, it's also the board meeting of the Global Fund in Malawi, a country that is, extremely affected by climate change. And for that board meeting, the Green Climate Fund approved for the first or the second time, actually, a program with a health component. So now Green Climate Fund invests in health in Malawi, and this is aligned with the Global Fund funding, and that will be announced at the board meeting in Lilongwe this week. And there are many other countries that are in line for that. And our team was asked to kind of facilitate these two quite different funds, Green Climate Fund, Global Fund, how they can bring their significant resources together so that countries more easily can access that. And that's also done in partnership with the World Bank, with WHO, with UNDP and others. I think that's the way to the future, that we bring these various funding opportunities in climate and health together. There will be efficiency also gained, and it will be much easier for the countries to kind of apply for these interventions that make them more climate resilient in their health systems. What is required now, and what we can now really encourage, is that civil society and the communities on the ground can now finally also help to express the demand, so that it is not just the kind of top-down, exercise funds decide we want to invest in certain countries. But now we are at the point where we can really encourage the communities on the ground, express how you want to shape the resilient health systems for the future. And then maybe we can point to the right financing mechanisms that can finance that. And they then, of course, have to go out with that also to their donors to appeal to that, so that this is really kind of a new and exciting way how to finance our common future.
Thank you. Thanks, Christoph. And I'm going to turn to Yassine to maybe pick up on something that you just said about bringing in civil society and communities, which I think everybody says, but nobody pays for. So I'm wondering, Yassine, if you could talk a little bit about some of the changes you think are necessary to really make that a reality. Is it funding? Is it shifts in governance? Is it policy changes? Would love to hear from you on that. And then also just thinking about what Vanessa mentioned about the number of reports and information that's being released on all of these very important issues. Sometimes that doesn't reach civil society and communities, or it's not made accessible or translated in a way that makes sense. Can you just talk a little bit about how we bridge that divide to make sure that people have the information they need to make informed decisions?
Thank you. So perhaps maybe starting from, a particular example of an initiative that we've worked on specifically with the Global Fund and a private sector organization that had come together. And we're really looking to see how they could support community-based organizations that were led by women and girls, but that were not necessarily able to tap in the existing structures of the Global Fund. And through this initiative, there was catalytic funding, mentorship, leadership that was provided to some community-based organizations so they could engage more actively in health programs and policies that impacted their health. And what we've seen in Burkina Faso, for example, is one of these young community leaders who did not even know what the Global Fund was 3 years ago before the program started, is now sitting on the country coordinating mechanism in Burkina Faso. They've created a whole category for women and girls, and she's one of the 2 representatives in that category. And now with the other women within this network of 60+ organizations, they're now advocating to express what they need within the formal mechanism. So I'm just using this example to show that even with large financial institutions like the Global Fund, there are opportunities to look at innovative ways in which we can put in place funding mechanisms for those organizations. I think, as you mentioned, Elisha, certainly the language barrier always is a problem. The reports stay at one level, but then, many at the communities are not able to understand them to read. So it is also up to civil society organizations at national level to also work with communities and ensure we're translating so that we are taking into account those needs and then creating that demand for global institutions so that it's integrated. And more, and I think this is what I'm always advocating for, is making sure there is a seat within the governance structures of all of these funding mechanisms and others for organizations from the South and that represent communities so that we're able to start engaging. And that's happening, but as you said, it's happening sometimes more in representation, but not necessarily in the sharing of the power. So it's also a question of looking at how do we ensure that civil society, when they are at the table, also do have that decision-making ability. So it's definitely work in progress, but in the past 10 years that we've been working on this, we've seen a lot of change already. And so I'm very optimistic that, we'll be able to get to that point where we do have an engaged civil society from across the world.
Thank you. Thanks, Yassine. And David, I'm going to ask you to just come in here because we've talked quite a bit about multilaterals, government responsibility, civil society, and we haven't touched too much on the private sector, but certainly innovation moves maybe a little bit faster in the private sector, if we could say, than it does with governments. And so just curious from your perspective, what do we need to change to have better public-private engagement around, integrating AI, integrating technologies into some of these bigger conversations, and making some real change? And then also just thinking about some of Yassine's comments around the gender digital divide. I mean, obviously VIAMO is working to address that, but what do you see in the bigger landscape as policy changes that would help with that? And after David answers, we are going to turn to the audience for Q&A. So if you want to queue up, you can use the hand raise function, or you can drop your question in the chat. So David, let me give this to you, and then we'll take some questions from the audience.
Okay, great. Thank you, Elisha. This is a really good question. And my general advice is to try, and this isn't easy, but to try to find ways to bring technology companies into your projects as partners rather than as vendors. And that's easy to say, and it's hard to do. But in essence, what you need to try to do is to pitch them in a way that they can clearly see how your project will contribute to their own sort of goals and objectives as a private commercial company. So an example here might help. So I've spent much of my career negotiating with some of the biggest and most important technology companies working in low-income countries, namely the national telephone companies. And I can tell you from experience that nobody likes to talk to the telephone companies. However, they've become a real key partner of ours. So every year they zero rate the calls to the Viamo platform for their subscribers. And last year, those 400 million calls, more than 1 million a day, were worth hundreds of millions of dollars. And I have to tell you, they didn't do this out of the goodness of their hearts, right? The way that we were able to convince them to partner with us is that we showed our telecom partners how the Viamo platform improves their customer loyalty. So despite the fact that it's free to the end user, it actually benefits their bottom line because these companies are operating in a crowded, competitive market, and they will do anything they can do to hold on to their subscribers and even steal from the other guy. So any idea that you can offer them that increases the likelihood of loyalty, increases the likelihood of a little bit more of a spend on the individual's phones, they're very interested and open to these ideas. So again, maybe try to find ways to bring technology companies in as partners rather than vendors.
Thanks, David. I think that's changing the message for your audience is something that resonates with many of the folks on this that are participating in this tried and true advocacy technique. I'm going to, we have 2 questions in the chat, and unfortunately we're running short on time. So I'm going to turn to Vanessa for the first question, which is asking about what the role of WHO is in addressing the impact of climate change on health systems in low resource countries.
Thank you for the question. So I think there's a number of ways that WHO is trying to help. One is very much through just the general data, driving the awareness, building the understanding of the importance of climate change and the impacts it's having on various health systems. One of the key things they do, though, is they do directly support member states to understand both what the impact of climate change is very specifically through vulnerability and adaptation assessment. So they have a very strong tool that supports these governments to be able to understand the ways that their health systems and populations are being impacted by climate change. But then they also work through something called ATTACH, the Alliance for Transformative Action on Climate and Health, which has built around 5 thematic working groups to address common issues, which includes financing the health commitments on climate resilient and sustainable low carbon health systems, building climate resilient health systems, how to build actually, because the health sector is such a key contributor in general to climate change itself. Generally 5% of all greenhouse gas emissions come out of the health sector, which is more than the airline industry. That's up to 10% actually coming out of the United States and some developed nations. So they're really focusing on how do you make that a greener system, greening supply chains and securing supply chains, and then a lot around climate action nutrition. The functions of ATTACH look at very specifically monitoring, quality assurance, financing, coordinating technical assistance, and embedding. So they're thinking very concretely about how to support member states, especially low-income member states, who are the most vulnerable to the impacts of climate change around this. And so I'm happy to talk more or to continue to David's question, which I think is a very poignant one for this time.
Yes, I think David's question is a great wrap-up question, perhaps, since we're running short of time. And that question is about the rightward turn in politics in the US and in Europe, and how will that impact this agenda? And I think particularly for many who are joining the symposium conversations, the question is, how should advocates respond? What's our best approach to protecting and promoting progress on this really important global health agenda? So Vanessa, I'll just, since you're already speaking, why don't you take that one first? And then I would love to hear kind of a closing sentiment from each of the other panelists using this as the guide.
I think the rate return is concerning in the sense of how bilateral countries are going to put up climate forward action that we need, right? We are off target for Paris. We are on Paris supposed to get us to 1.5 by, really keep us there by the end of the century. We're on track for 3. And you can already see every even slight point of a degree more is creating more climate change. So recognizing that, I think the quick answer is that we have to look for allies across all sectors. So while we do need to continue engaging government, and in the US, I would not use the word climate change. I would talk about extreme weather. The Florida governor cannot deny that extreme weather is impacting his state. So I think if we are strategic about language and we are strategic about how we find shared value, even across deep political divides, we may be able to create common sense movement, because at the end of the day, they are responsible for the well-being of their population. So the question is, what is the language we use, the data we use, and how do we try to move in the right direction for the protection of people? But outside of governments that may not be as sympathetic to climate change, we have to realize that there's many other partners that can accelerate and drive the impact of what we're doing. So I think businesses are realizing they don't have a sustainable path forward if they don't have a product or healthy people to sell to, or they don't have the resources they need to make their product. So how do we engage the private sector partners to mobilize more funding and to make the investments that we need? How do we work very much with local governments? So mayors have been incredibly proactive. And so I think we can get more localized in the interventions that we do. Think about how to work with partners like the National Governors Association and others to really move to where we're going. So I would not get despair. I would really just take a deep breath, look at the evidence, and stop and say, and I don't mean that, sorry, that didn't mean that patronizing, and say, take a deep breath. But that always helps me when I stop and say, okay, what is the landscape? Where are the places that I can move? And to realize that there's a lot of partners out there that are very keen to do the right thing right now. And so I think it's about a question of finding who they are and just thinking strategically about where are the places we can make profound progress in this moment, and what is the evidence and the language we can use that creates shared value in a way that we can find common ground.
Thank you, Vanessa. And we are actually at time, so I'm going to have to ask Christoph, Yassine, and David to give very brief remarks to this. I'll turn to you at first, Christoph.
Thanks, Elisha. And David, great to get the question from you, because you've been involved in this kind of advocacy, and you will remember how difficult it was just 25 years ago to convince at that time, also conservative Republicans, that they should invest in HIV/AIDS and tuberculosis, malaria, and so on. It was not easy at all either. It was not exactly the topic that most of them would have chosen. But it was possible through the adaptation of the messages to win that support. And actually, it's amazing how over more than 20 years now, there has been pretty strong bipartisan support for PEPFAR, for PMI, for Global Fund, in US Congress. I know this is much more challenging now, but I think we need to apply exactly the same tactic. We need to identify which are the messages that resonate, with that particular group of policymakers. Vanessa provided quite a few interesting data points, right, that would be of concern to anybody in their constituency as they feel the impact of climate change. And climate change of health is something that they should care about for the future generations, for the families, for their kids. So I would argue similar challenge, difficult, but not impossible if we learn some lessons from how it was done a bit more than 20 years ago. But thanks, David, for that question, and I'm sure you will be part of that.
Thanks. And I'm getting a notice that other sessions are starting. So David, I'm going to give you 1 minute, and then Yassine 1 minute, and then we're going to have to wrap up.
I don't think I have very much else to add. I've been working in international development for 30 years, and Democratic and Republican administrations come and go. And when the Republican administrations come in, there's panic, there's pearl clutching about what's going to happen to overseas development assistance. And the truth is that it keeps going up. This administration feels different to me, to be frank, but the type of strategies that have already been discussed, increasing the partner landscape to try to find new and interested partners to help in this fight, I think is right. It's also critical to get the language right, because if you talk about global security with this administration, it might go over much, much better than even climate change and even public health. So getting the language right, I think, is important as well.
Great. Thanks. Thanks for those words, David. And Yassine, you have the last word.
Fantastic. Well, I think most of what I was going to say has been said, but at the end of the day, I think, it's challenging times everywhere, in the US, in Europe, in Africa. And certainly, I think as we think about this, it's really putting, the people at the center of the response and really humanizing also the story and really looking at, how can we best message? And, it was just said, the language is critical. So it's just upon us, I think, to take that moment, as Vanessa was saying, and really take a step back and look at, what we have today in terms of landscapes and adapt to it, knowing the challenges we face. But certainly for me, it's really putting the people at the center, and also as we're thinking about this, also ensuring we're taking into account, people across the world in the work we do.
Great. Thank you, Yassine. Thank you, Vanessa, Christophe, David, all of the panelists. Terrific discussion. Obviously an hour, not nearly long enough to cover all of the things we would like to, but that's why we have 4 days of the symposium. So lots of other sessions for folks to really dive in more depth into these various conversations around financing, technology, climate, and equity. I hope that you all can stay with us and take part in some of the other sessions that are happening this week. And thank you again to our panelists and for the great questions from our participants. And everyone have a great rest of the day. Thank you.
Thanks a lot, Elisha. Bye-bye.
Bye.